I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Right. Please remain standing for a moment of silence for our legislator Dave Holmes. Passed away last month. Thank you. Welcome, everybody. Approval of the minutes. We'll second. Get that, Betsy?
Yep, I got second by
Yep.
Lee. Okay.
All in favor?
Aye.
Opposed? Motion carries. Resolutions, 81 resolution authorizing budget mod for early intervention transportation. Julie,
So H1 is resolution requesting authorization for a budget modification to increase the early intervention transportation budget by $15,000. This increase would be offset by state aid of $7,350, and then the rest, $7,650 will be from the appropriated fund balance. Transportation and related costs are considered part of the early intervention program when it is needed for an eligible child and their family to access services. If a parent is unable to provide or obtain transportation, the municipality where the child resides is required to arrange and pay for appropriate transportation as outlined in the child's individualized family service plan. The transportation program's first full year of operation was in 2025. During the first quarter of 2026, we saw an increase in enrollment. In addition, 27 children were carried over from the 2025 roster. Transportation costs for 2026 are projected to reach $35,000. Therefore, an additional $15,000 is needed to meet this anticipated expense.
thank you for holding for discussion.
These students are qualified by the school district or schools.
This is the presentation you're going to receive also today from Sherry from the bowling. Sherry, you want to speak to that?
Yeah, so early intervention is for the 0 to 3 population. So they are deemed eligible set by standardized testing under the Bureau of Early Intervention under the umbrella of Department
Referrals come in from physician's offices,
of Physician.
families might call and say they might have a delay with the child.
How many companies did we have last year?
Many
Children
children
in
in public school.
Yeah.
It was, I can get the exact number. It was 340 something from January until December. That's the amount of referrals.
But
Right.
because some of our stuff is like a year behind.
Yeah, that was 2020.
Anybody else? All in favor?
Aye.
Aye. Opposed?
Paul, did you get a first and second?
Oh,
Second.
all right. All in favor?
Aye.
Opposed? Motion carries. All right, out of the resolutions, we're going into committee review and decisions. This is a bid for a new single white trailer in the Shad Slade fuel station. It's our mosquito trailer, and I can't tell you how old it is. It's under a long time.
Over 30 years old.
That's the one we're getting rid of.
That's correct.
Yeah.
We received one bid from Wholesale Homes located at 466 US Route 11 in Central Square. The team at the health department was put together and evaluated the bid that we received and is requesting approval. The cost was $99,500, and that's for removal of the old trailer, set up with the new trailer, and cost of the new trailer.
Well, that includes the removal of the old.
Yep, everything.
And how much was that again?
99.
90. Yep.
We have to have a trailer or a portable unit there. You can because it can't be.
according to the D's,
For the deed.
if that's their land.
So what about well? We're gonna drill a well?
We are,
We are.
we had to get approved from the DEC when we can drill the well, because there's only certain times during the year.
But that's not included in it.
No, that's separate. But the money is there. And, we do have a capital project
Yeah, we.
that includes all of it.
Yeah, that's what I thought.
We do.
And who's gonna fill in that well?
Whoever gets the bid for to drill the well,
Okay,
It would be
that's the plan.
It would be interesting to see who drilled the original well.
I think it's Doug.
it's a dog well. I
It's a
think.
dog well?
Yes.
Yeah, there's a board with it.
Yeah, it's kind of a gritty well, but not.
Yeah. We'll leave that alone.
And this trailer that we're getting, was it gonna stay there permanently or will it be taken out, stored or?
It has to be able to be taken out. Oh, you mean annually?
Yeah,
It will stay there.
okay.
It's actually a single leg trail. They will anchor it down.
It's not bad anymore.
It is on a
It is
pad.
on the it's got the effect.
Yeah.
Thank you.
You're welcome.
So I need a first and a second on this. Legislator Walker, Legislator Soloway. All in favor? Opposed? That was wholesale, right?
Oh, some home. Yeah, that's square.
Reporting departments, director's report.
So we're fully staffed in our mosquito program. This is our first full week where we are getting the field station cleaned out. We're getting it set up and we're starting to set up some traps to start collecting mosquitoes for training purposes. Training will begin next week with Dr. Oliver, and we are partnering with other counties as well to conduct the training and go through that whole process. There's a lot of new staff, so other companies are helping with the training. And that's with identifying mosquito species, how to send them out, things of that nature.
So we are training other people too.
Yes, and they're training some of our staff also. They have some senior staff at other counties that do mosquito surveillance, so they'll be training our staff also. Dr. Oliver recovered this year, but she is coming back for a 1-day course where she usually does training that lasts over a week and stays out there, and she won't be here. She will be missed, but we're lucky she's coming back for 1 day. Rabies, our Plaskite clinic on 5/6, we vaccinated 307 animals, where we had 253 dogs, 54 cats. We had donations of $6.48 per animal, which was a total donation of $1,988. Our parish clinic that was held on 5/20, we vaccinated 103 dogs, 24 cats for a total of 127 pets, and we received $917 in donation, which comes out to $7.22 per animal donation. Our next clinic will be held on June 10th, and that will be at Bristol Hill Transfer Station. Our beach sampling, our first sampling was taken on May 18th, and we always do that the right before Memorial Day, make sure that it's safe to swim, even though it's cold, we can swim this year. And then we are on to weekly sampling now, and we'll do that up until Labor Day. Children's camps are up and running. If not, will be soon. Couple camps aren't operating this year due to operational space and or trying to find a camp director, which that does happen. Our health education and emergency preparedness, we delivered our pull-off kits for OCO outreach. Their staff is delivering the pull-off kits that we talked about. That's the mini grant that we received. Weather in the storm, mini grant. Training was provided to approximately 25 OCO staff members. We are working on the year 14 performance incentive for oral health, and that's the fluoride varnishing. We reached out to several agencies, Next Care, Struggle Health, Prime Care, Riverview Pediatrics, about providing fluorine varnishing as part of their well child checks, and offered education and training for those agencies. We also started a summer social media campaign called Food Myth Monday, and that's around food safety. So look on our website for that and Facebook. So that's a little fun thing we're doing. And we're also working on the baking cessation public service announcement campaign, and that's with City BOCES using Trellis marketing. It's a year-long campaign on social media and streaming services that includes a landing page to direct folks to cessation resources, and that's part of our dual settlement funds that we're using. We are working on developing antivirus tabletop exercise with EMO. They're going to put something together and we're going to drill on that. We also developed a new communicable disease emergence subcommittee, and that's for all risks that we'll be looking at. And it includes diseases right now as Ebola, hantavirus, New World screwworm, and things alike. We've increased our Narcan training and risk and requests for kits. We believe this has to do with the new legislation that is requiring Narcan to be added to all first aid kits, and that any businesses that are federally required to have first aid kits need Narcan kits in them also. Doesn't say anybody needs to be trained for them, but they do need a kit to be in the first aid kit. We are building lots of tickets for tabling events for the summer. Our Healthy Families program, we are at capacity. We are not refusing any referrals. We currently received 9 new referrals at our community baby shower that we are working on to get these families admitted. During our OCS, which is Office of Children and Family Services review, we received 15 out of 16 on our performance indicators, with prenatal enrollment being one that we missed. And we also received 12 out of the 13 performance and targets, with breastfeeding being the one that we fell down on. So we are doing QI projects to look at both those areas and how we can improve on that. We're also working on a summer event for July. Our preventive and LIPSA program, communicable disease, is seeing respiratory illnesses continuing to decline, but we are seeing an uptick in the GI and parrots, which means intestines, and tick-borne diseases, which is very common for this time of year. Immunization clinics continue on Tuesdays. They are much slower this time of the year, but we're started working and reaching out to all the school districts so we can do some off-site clinics to mitigate the back-to-school rush that we know we're going to see. MCH, the census is growing with newborns, getting newborns admitted, and the CLC, which is our lactation, certified lactation counseling. Any questions?
What's a screwworm?
So that's actually a parasite. I could send you a lot of information on this.
Is it in humans, animals?
Mostly animals. So we see it, and they've seen it from 2022 from Mexico to Central America. It's a parasite fly that lays eggs into open wounds and or any body organs. The CDC has been tracking it. What brought it to our attention is that it's about 50 miles out of the U.S. right now, so we have been watching it. It causes painful, foul-smelling wounds due to the larvae infestation. Current data, total animal cases is 25,888, and active animal cases right now is 1,970. So that's another reason why it's important that we have the subcommittee. We are keeping track on all these
So
emergent
have we
issues.
ever had that before?
No,
So basically what I'm thinking is the south central part of the,
but it's moving this way, and that's why we're tracking it. Approximately 170 human cases reported in Mexico, and a small number of deaths, as long as it's off.
that affects any animal,
Yep.
anybody with, any animal with an open.
Yes, that's true.
Any other questions? So. Okay.
Okay, so I'm going
Thank
to
you, Vera.
introduce. Okay,
Oh, go
you
ahead.
want me to introduce Sherry Crispo?
Absolutely.
Sherry's the director of Special Children Services, and she's gonna provide an overview of our early intervention program. She's also gonna give the update for her other programs within her division, because she's here.
Just something,
Sherry,
just something on the lighter side. I've known Sherry for, I don't know, 20+ years, and she was my daughter's maid of honor at her wedding. She's also my constituent. Thank you.
And who would have thought when you asked for somebody to come speak that it would have been, there you go. There you are.
Thanks.
Thank you for having me. So as Vera said, I'm the Director of Special Children's Services at the Health Department. We have several programs there. They include early intervention, preschool special education, children and youth with special health care needs, and child find. This time of year, the preschool sector is what we refer to as annual review season, and that's when all of the children that have been identified as needing services are met on through this school district committee on special education. So it's a very busy time for us. We have a new children and youth with special health care needs program coordinator. She started with us on April 27th. And overall, all staff have been busy out in community events. We had 3 staff that attended a statewide early intervention and SHIN summit on May 19th, 20th. We had 2 staff that were invited to table at an event in Hannibal at the Fairley Elementary. It was the Healthy Family Night. And we had 2 staff that were invited to table at the Spring Resource Fair at the Polish Home at Bolton on May 7th. So that's a little bit of overview of what's going on in the department as a whole. Then I was asked to go more in depth on early intervention. So just to give you some historical data, early intervention is for infants and toddlers with disabilities and or developmental delays and their families. Early intervention was created by Congress in 1986 under the Individuals with Disability Education Act. It is administered under the Department of Health through the Bureau of Early Intervention. Early intervention is established in Article 25 of Public Health Law and has been in effect in New York since 1993. To be eligible for services, children must be under the age of 3, have a confirmed disability or an established developmental delay in one or more of development areas, and those areas would include physical, cognitive, communication, social, emotional, and or adaptive. And the overall purpose of early intervention is to ensure that those children that are identified as having a delay or disability receive services that they need to maximize their developmental potential. So the process of early intervention is at the health department. We are the single point of entry. So all referrals through Western County come directly to us. Referrals can be made by a parent, a guardian, physician, TSS, foster parents. Once a referral is received, family is assigned an initial service coordinator who's responsible for completing a full intake with that family. That initial service coordinator will also coordinate a full developmental evaluation. And then eligibility is determined at that point. If the child is deemed eligible, an individualized family service plan is created. They're assigned an ongoing service coordinator, and then a search for providers will begin. Children will exit early intervention through several ways, either the day before their 3rd birthday, and that's because they're no longer age eligible for that program, if their goals are met, if a parent has requested discharge, or if they move out of county. Services may include assisted technology devices, audiology, family education, occupational therapy, physical therapy, psychological services, service coordination, special instruction, speech therapy, vision, and transportation to and from health services if deemed necessary. And all services are provided to families at no cost. At OCHD, as I said, we're the single point of entry. We have 2 full-time early intervention official designees who also serve as that initial service coordinator. We have 3 full-time ongoing service coordinators. We have 1 full-time special education teacher, 1 full-time occupational therapist, and we have 1 full-time support staff person who supports our whole division. Evaluators and any other providers that work with the family and that partner with us are approved through the New York State Department of Health, and the state provides us with a directory of service providers who are approved to utilize. Some current statistics for you, and this was as of yesterday. From January until yesterday, we have received 148 referrals. The qualifying rate is 39%, and we expect that to increase. We have 40 cases that are currently pending evaluations. And the average qualifying age for a child at this moment is 1.51 years old. We do have a significant wait list. All areas of education are drastically lacking providers. So at this time, we do have 137 children that are waiting for a speech therapist. We have 14 children waiting for a special instruction teacher. 35 are waiting for a physical therapist. 27 are waiting for an occupational therapist. And fiscally, we are responsible for the costs. We're reimbursed 49% through escrow, and then we can also seek reimbursement through Medicaid.
What was the last word? 49?
Medicaid, 49% through escrow.
Yeah.
The state fiscal agent.
Okay.
Any questions?
That waiting list that you have, how long does that take to get, how long have they been waiting?
We have some children, so they can come into the program anytime between the age of 0 to 3. We have had some children that come in early and they will exit the early intervention program having never received it.
So the oldest is 3 for the early intervention.
Correct.
And the youngest you've ever had is what?
0. So when they're, yeah.
So it's 148 this year on top of the 137 that we invested.
That 148 referrals, the 137, some of those children may have been carried over from the previous year.
But we still have the children from before.
Yes.
Right, so we're still talking approximately 40% of 148 plus 140 kids.
So the 148 is just as what was received referrals from January. And then the wait list numbers can include your spans. And there's actually surveyed. I don't have an exact number, but I can give that.
I was just curious because that many comments on here on wait list.
I
You're
can tell
figuring
you,
out because of.
yeah, so our ongoing service coordinators right now, they have a caseload of 69, 75, and 74. Our initial service coordinators have 142 and 70, but the initial service coordinator always follows through with that child. So the initial service coordinator and the ongoing service coordinator will share families. So the ongoing is included in the initial. That makes sense.
If you had more money, you could serve more people, right?
It doesn't matter how many.
I was curious,
don't-
how do you?
This is the mandated program, we have to pay for it regardless if we have 40 children or around 500 children.
But I mean, you'd be able to get some of these people off the waiting list.
Our
No,
the issue is providers.
The providers,
Okay,
there's no,
there's not enough providers
Correct.
around.
And that's an issue throughout New York State, if not,
Okay, that was almost me once.
It's like the nursing shortage, the physical therapists, occupational therapists.
This
speech
improves our transportation costs, but you have to transport them where they want to go.
Right, that's correct.
With services.
Available.
Right, where the services. That's a challenge.
It's a head.
So, once those children age out of 3, so what is preschool? Three. So school district is then becomes responsible.
correct.
And what are those for school district?
So we have 9 school districts in our county. We are more of the fiscal agent for preschool, so we don't track the numbers for preschool. We pay the bill and the district is responsible for evaluations, provider searches.
You mentioned Medicaid. Do you get any private insurance or other insurance?
No, we don't. The way it actually works is that we bill the state fiscal agent, and then the fiscal agent takes that and bills Medicaid for us, and then we get paid out of the fiscal agent. So there's no private insurance at all. The providers bill the fiscal agent. We don't see any of that information.
I'm naive about how early intervention might work for, say someone that has income, has good insurance, can they get their own personal interventions on their own?
So families are always welcome to go out and pursue services on their own and pay independently through their own insurance. But we wouldn't reimburse for that.
Right, but do you know if that is done a lot?
Yes,
Okay.
especially right now with the provider capacity. We see many families in early intervention and preschool going that route.
So it's those that don't have means that have to go.
Many counties.
Everybody else? Great conversation. Thank you very much.
Thank you.
You're gonna bring somebody next.
Yes, I am.
Right, move on. More information, financial disclosures, we don't do that here.
Those are strictly informational.
I think,
Those are strictly financial or informational.
right, something. All right, any other questions? Guess I'm looking for the appropriate motion. Second, all in favor?
Aye.
Opposed? Motion carried. 29 minutes of speed. Love
Oh, thank you.
Oh, careful before somebody else gets it here.
it. Oh, yeah.
We're not gonna go.
Bring it on. Thank you very much, ladies.
Thank you.
Thank you.